All. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So today with us, we have Shaun once more with us discussing the vaccine injuries and his journey through them. We have had Shaun with us twice before, once when his injuries were started or were in the early time. Then we did a follow up as well. And today we have another follow up. The thing that I really love about Shaun's work is that he is proving to us all who may have vaccine injuries. I have two family members with the vaccine injuries. He's proving that if you stay after this disease, after this issue, you can start solving it. And there is hope. And so that is the message that I think Shaun would give us. Shaun, welcome.
Thank you, Dr. Bean. It's really great to be back and to bring some positive news to you since we last talked.
Excellent. So, how about if we can give a quick update, and then I want to go over how to find you, and then I want
Mhm.
to go over a little more in detail for how various therapies and your interactions are working. So, at this time, from a clinical point of view, how are you doing?
So a lot has improved. There are some things that have somewhat remained the same or slightly worsened. But I think when we last talked, I was undergoing subcutaneous IVIG after moving from intravenous, and I was really struggling with that method of treatment. I was having a lot of side effects. It was increasing some of my tinnitus. It was giving me some clots and mild hemolysis. So at a certain point, although it was improving some of the neuropathies, we decided with my care team that we should really halt it, give my body some time, see where things were going. The neuropathies remained, uh, or they were lessened, but they remained after I stopped IVIG. So in continuing discussions with my care team, presenting them the data again about the autoantibodies that I developed on the cell trend labs that I really believed told the story of my symptoms of the neuropathy, the positional tachycardias. We I discussed with them what other possibilities there were. And, one of them that was the apheresis or plasmapheresis that I was considering traveling to Germany for, that they were trialing there. And I reached out to the German researchers who were looking at these autoantibodies and also the clinics there that were trialing apheresis, talking about the different successes they had. So my neurologist was like, "Well, let's see if we can get this done for you here so you don't have to travel to Germany." He's like, "If, let's look at all the evidence." So we started to research, pull articles where they use plasmapheresis to treat uh, small fiber neuropathies, Guillain-Barré syndromes, things that were kind of in line with the symptoms that I was experiencing. So lo and behold, he was able to get the plasmapheresis approved. But at the hospital where I did it, they do it as inpatient. So I had to be admitted for 10 days and they did 5 cycles of exchanges. So they literally removed all of my blood each time and they replaced it with albumin. They separated the red from the white and they put the red back in with albumin. By the third cycle, I noticed already some improvements. My energy level was coming back. My brain fog was getting less. My neuropathies were getting less. My arrhythmias were stabilizing. By the time I was discharged and home, I no longer had atrial fibrillation episodes, and I've been free of AFib since my discharge, free of PVCs, these premature ventricular contractions, and free of supraventricular tachycardia episodes. So I think that's pretty profound, because I don't know, many cases where some people have atrial fibrillation episodes and then suddenly for 6 weeks they're completely free after having them, several times a day.
That is profound.
Yes. So that's the positive side. The downside is the tinnitus didn't really resolve. So it's still there. It's pretty debilitating. I've had some quieter moments during and after the plex, but haven't really, what I would say, reached a point where I could say I'm content with it. It's still problematic. It's still disruptive to my life. It wears
Yeah,
me down.
tinnitus is a, yeah, it's a tough
It
thing.
it is a tough thing, and like I said to friends and family, sometimes I, would exchange some things for other things, to get rid of the tinnitus. So it's
Yeah, tinnitus
pretty,
is really hard.
yeah.
So so thank you very much. What I really thought was great about the journey and the current state is that you had mentioned sometimes in our discussions, um, that you are afraid that these problems, the neuropathies, are occurring because of permanent damage to various tissues. And that I could see that in many of your texts where you would say, unfortunately, this seems to be permanent.
Mhm.
And now, after electrophoresis, plasmapheresis, it seems like when most of those symptoms went away, the cardiovascular symptoms or the neurological symptoms, when they went away, that means it was the autoimmune disorder and the tissue damage had not occurred. It was still the antibodies or immune dysregulation that was causing inflammations. And as you removed those offending agents, you felt better because your tissues were still healthy.
Right. I think that was always preying on my mind, right? And I think on the minds of all of us that are injured is like, how much of this is permanent damage? I also worried about that with my heart, right? Because atrial fibrillation is not a small, uh, affliction. So I was like very stressed about that, and like, how am I going to live with this for the rest of my life? It could be a chronic condition. But I always kept in the back of my mind that the neuropathies were very strange in nature. They weren't like typical neuropathies of diabetics, or people who abuse alcohol, for example. They were very intermittent. So it would be, on occasion in my hands, in parts of my hands or parts of my feet, or in my face, some burning in my neck and chest area, but it would be intermittent and random. So one day, one minute it will be in one place, and the next minute in another place. And I thought that was a peculiarity of for neuropathy. Usually people have, in their hands and feet, and they have it, and it's at different levels at different times of the day, but it's there. But mine
Correct.
would
It
just
becomes
be,
permanent.
yes. So I think it's a good sign that I did some interventions and they go into remission and there's no residual permanent
Which is
damage.
tremendous. So I feel bad about the tinnitus. I'm so sorry, and I really, really pray that you recover from that as well. I really pray that that is also a temporary thing, just like you saw the other ones. And as doctors become a little more convinced to try
Right.
solutions there as well, hopefully you'll recover fully. I have to admire your dogged persistence. I believe we had been exchanging messages for months where you started doing the research to figure out I am vaccine injured now and I have these symptoms and what should I do and what should I try? And you did not give up. I am seeing so many patients whose doctors have told them that this is it. My own family member's doctor told her this happens in this age. When it bothers you too much, the neurological symptoms, when these bother you too much, just come over and I'll inject Botox.
Mhm.
That was told to her, and she had accepted it. And here you are, that you're continuously running after this, chasing this, fighting this. And KoolBeens, before this discussion started, I was talking with Shaun that what is admirable is that he was chasing and fighting to figure out a cure or a treatment or a management while going through the worst outcomes and the fear of permanent damages. So, Shaun, once again, thank you very much for doing it, because now you're adding light for the rest of us as well. And I'm happy that many areas of your symptomatology are improving.
Yeah, I think the biggest, like you touched upon with the tinnitus, is that I don't give up. Even with the tinnitus, I don't give up in my darkest hours. And even, how much suffering, and I like the others out there, I have cried many days since this happened to me. I probably for a year I cried every day, sometimes 2, 3 times a day, and wake up in just total disbelief. But I refuse to give up. And I think getting connected with the organization we started, React 19, it just gave me that extra push, connecting with all the other people who were injured, um, you know, inspired me to turn the bad into something good. But even with the
Got it.
tinnitus, like you said, I don't give up. I keep going to ENT visits, even though, we know that they're reluctant to help, but it puzzles me and troubles me that why that community, that profession is not curious about what has happened to us, how they're not willing to investigate and trial different treatments to lessen that affliction, because it's has such a profound impact on our lives. But I still persist. I still knock on doors. I still ask questions, and I don't accept that there isn't something we should do. That we shouldn't do something. I think we have to try. We have to push. We have to know why this affected the ears, what's going on, and how can we lessen the severity in some way.
And this persistence has actually brought us hope today that uh, you got electrophoresis, plasmapheresis, and you're feeling much better. So maybe there are so many others who may actually benefit from a simple thing, and they are becoming disappointed, they are giving up, or they are giving in. And so, thank you very much for this. I wanted to do something last time, last two talks people had been asking me afterwards to say, how do we reach out to you or how do we contact you? So if you are okay, I had asked you for the links to various presences of yours. If you can just very quickly give us a quick walkthrough. This is your Facebook account.
Right. So I'm not very tech savvy. I do have a Facebook account. It's probably the worst place to try to connect with me, because I don't I don't spend a lot of time on my own account. Nowadays, I spend more time in our tinnitus support group, and on with the work with React 19.
And this is the tinnitus support group.
Yes, this is so I had started one early on, when tinnitus first appeared as one of my symptoms. And then there was another person, Deanna Balcom, who had another group, and then we decided to merge the two, and we formed this one large group of people who have tinnitus after the vaccine or hearing loss impairment.
Got it. And the benefit of this group, if let's say I have tinnitus and I join here, um, what is the help I can get here?
So there we share. So we did our own research through that group with a professor in Arizona, which we hope to get published, which talks about um, not only how many people had tinnitus after the vaccine, but what treatments they had tried, the kind of progression over time we look at. But in this group, you can get support. You can get you can ask questions. You can find out what people have tried, what worked, what didn't work, how people's symptoms evolved over time, how people are trying to manage their tinnitus. We have suicide resources there. We also try to catch new members right away because there has been some preliminary research that says if you get steroids or within 72 hours of your onset of tinnitus, you can get sometimes some resolution. So we
Got
try to
it.
catch those people and advocate that they seek that kind of therapy. So it's a good place for all kinds of support.
Got it. Thank you very much. And this is the React 19 that you had actually shared last time as well.
Correct.
Tell us
So
a
this
little bit
is
about this.
yeah, so this is an organization that was founded by Bree Dressen, who was injured during one of the vaccine trials, and Dr. Joel Walskog, orthopedic surgeon who was injured and developed transverse myelitis. So together, a group of us connected with them, and we formalized the founding of this nonprofit organization that's really focused on stimulating research, offering, again, networks of support. We're setting up patient advocacy so people around the country can reach out in their region to find other injured, to find out what doctors they've seen, who's been, who's up on vaccine injury, who's willing and able to help them. We also have conducted some surveys to try to stimulate more research. We raise awareness. We work on advocacy in Washington D.C. So it's a small group of injured people cobbled together, and in our suffering, when we have our moments of functioning, we work together to try to help the injured. We also have a
Got it.
fund program where we give small grants, small funds to people who are injured to help them with their medical bills or to pay for medical appointments.
Got it. Thank you very much. And this is what a wonderful thing to do, that you yourself are suffering and going through this journey. And in that process, you are adding light for others as well. So thank you for doing this. And this is Sean's Twitter. All of those links, I think this is the most important one, react19.org. I'm going to put that here in the chat once more. I pasted before and it broke down into smaller pieces. So one, and this is the tinnitus group. So I'm going to go back to our discussion. So I saw some KoolBeens here who are new, and they were asking, who is Sean? What happened? So if you can give us once more, what is your story? What happened?
Uh, in my vaccine injury,
Yeah.
in summary, I had my first dose early on in December of 2020 in my right arm. I had paresthesias up and down my right arm into my right side of my face, and I had right eye irritation. I went to see a neurologist. He did an EMG on my arm, said if the symptoms subsided, I should probably get the second dose. My instincts told me no, but I went ahead. Biggest mistake. I had the second dose in my left deltoid. All of the paresthesias reactivated on the right side and then progressed. After that, I developed not only the paresthesias, I had ear flushing, ear pain, tinnitus. That snowballed into tachycardia, wild blood pressure fluctuations, severe headache. That's further progressed into full blown autonomic dysfunction. severe insomnia, adrenal dumps, positional tachycardia. That continued on into small fiber neuropathy. I erupted in polyneuropathies from head to toe, worsening tinnitus. And that was over 6 to 8 months, kept evolving.
And during this time, I would love if we can present what were the possibilities, medicines, non-medicine, what interventions did you try, what research did you do?
So in the
So if somebody
beginning,
who has a similar thing,
mhm,
what can they learn from your experience?
right. I think one is never give in, never give up. If if you still have your ability to breathe and move a little bit, you just keep going. But for me, I think, being in the health profession, I think the biggest disappointment was the rude awakening that if something goes wrong in a situation like this, you're really on your own. You're on your own. And even though you have colleagues and you think that, oh, you're going to be fine, everybody's going to help you, that's not necessarily the case. And so it was a real rude awakening for me. And I said, I have to take this upon myself. I have to fight. I have to, push the system, because in the beginning, no one believed me. I would go and I would have this myriad of symptoms. And I must say, even if a patient came to me and they had like 10 wildly, diverse symptoms, I'd probably do an internal eye roll and think, my God, this isn't lining up with anything in conventional medicine. So what could it be? But I knew my symptoms were real, and so I pushed and I started. Even though I couldn't get help in the medical system, even though I kept telling them, this is clear in my case. I'm in research. It's not coincidence. It's the pattern is clear. It's related to the vaccine. There's zero doubt. I started cycling supplements early on. I was doing the antihistamine diet, antihistamine medications. I went into I did some low dose steroid trials like Medrol dose packs. I did non-conventional, so I did some ozone therapy, IV vitamin therapies, red light therapy. I mean, I really went in every avenue. I did acupuncture. I did meditation. Then I did uh, beta blockers for the positional tachycardia, which did alleviate some of the symptoms early on. I did uh, IVIG, which I had a lot of side effects to. I moved to subcutaneous immunoglobulin therapy, continued to have side effects. That led me to the fight for a trial of plasmapheresis.
And this was the plasmapheresis that eventually, so you had it last month, right?
In March 17th
You had
was
it in March.
my discharge.
And once again, for the benefit of the newer listeners, the reason for plasmapheresis, you had done your antibody profiles, correct?
I did. I sent my serum. I sent my blood everywhere that I could possibly send my blood. So I sent it to Germany to test for the autoantibodies, and that came back with several autoantibodies. I had antibody alpha and beta adrenergic antibodies. I had muscarinic cholinergic antibodies. I had high levels of anti-ACE2 antibodies, anti-MAS1 antibodies, and anti-angiotensin receptor 1 receptor antibodies. And when I looked at that, I mean, many of my neurologists dismissed it because they're like, wow, this is so many. These are IgG. I don't know what to make of this. These are research labs. But when I looked at it and I dug into those antibodies and looked at the possible impact, it aligned it those it's for me it told the story of my symptoms. It's we can't say with 100% certainty. I'm still anecdotal. I'm not a part of like a huge trial of patients, but the fact that I had those antibodies after plasmapheresis, I retested them. It removed most of them and lowered ACE2 and MAS1, and I had symptom improvement. So
That's
based on that,
profound.
I thought there's something here. There's something to this. I had some response with IVIG. It did help modulate my neuropathies, but didn't seem to be the best course in my case,
Got
given
it.
the
So,
side effects.
got it. So tell me this, since they cleaned out some of those antibodies from your plasma,
Mhm.
are you on some sort of maintenance therapy afterwards so that your immune system doesn't become dysregulated again and starts making them again? Or you are just no medicine anymore, feeling better, tinnitus is hurting, but I'm
Mhm.
going to go this way? What is your
So we
current, if you like
decided
to?
so we decided that we would just do the plasmapheresis, and then when I was discharged, the only medicines I stayed on were things for the tinnitus to help me sleep. So I went off the beta blockers. My cardiac situation was stable, and then the plan was to wait and see. So we wrote it up as a case study, and we're hoping to get it published in the hopes to help open the doors for others. And if things return, the plan is to go on an immunosuppressant and repeat plasmapheresis, and then continue on the immunosuppressant, something like an Imuran or a Cellcept. So
Got
right
it.
now I've
Thank
been
you.
holding steady. I have in the past couple of days had some, moments of positional tachycardia. I went back on a low dose beta blocker, but it has been nowhere near the scale of where it was prior. I mean, prior I was not able to stand for a shower, for more than 10-15 minutes.
So once again, for the listeners, I think I'm going to say it the third time, and if you feel you're getting bored of me saying it, but I think this is a very important point here, and that is Sean had this concern that these symptoms are coming from tissues that may have become permanently damaged. And it seems like his improvement after plasmapheresis proves that it was really the antibodies, it was the immune system's attack on the tissues that was causing those symptoms. And I believe if this immune system was not brought into check correctly and in timely fashion, there may have been permanent damage if this damage continued to occur, this attack continued to occur. So this is a huge and an important point to realize for those who are vaccine injured, that keep looking for a solution. Don't give up, because you can remove or at least control and tame this dysregulation and reduce the chances of permanent damage, plus recover a lot from those symptoms. Sean, is that a correct understanding from your journey?
Yes, I mean, I think I'm in no way, I don't want to mislead anyone into thinking I'm 100% cured.
Mm.
But the tinnitus is, I suffer. I suffer. It's brutal, but the journey is don't give up, don't give in, keep going, keep pushing, because it's you know eh, it's your life, and your life is worthy, and we as part of our even our organization Rack 19, our goal is to advocate for you and make people realize this is real. People are suffering, and people need help. And so
So
that is
one
why
more.
I'm out there telling this story, because I am pro vaccine, I am pro science, I am in the medical profession. I feel it is my duty to convey that message and challenge my colleagues, because to turn our back on people who just were doing the right thing is unethical and it's immoral.
Agreed. Um, so if I can ask you a few questions that Cool Beans here in the audience had been asking. So there is one question from Ledija. Did he ever try low dose naltrexone?
I did. I'm still on it.
Okay.
I'm still on it.
And how does it help? Meaning, if you're on it, have
Mhm.
you seen if you are not taking it, what happens? And when you take it, what happens?
So I started it more for the kind of the neuropathy, fatigue, and then also to see if it would help with the tinnitus. And so in the beginning, I felt like it did help. It did help. But I
Got it.
think the problem is my tinnitus is so bad, right?
Hmm.
That I think the I'll take the marginal benefit, but I can't say in my case it's like a significant improvement for that.
Got
But
it. Thank you.
but any minimal benefit if you have tinnitus is welcome, right?
Absolutely. Absolutely. Um, Krista says hyperbaric therapy.
So I haven't tried uh, HBOT. I was considering it. I'm looking into it right now. It's if you want hard HBOT, not the soft uh, HBOT. It's quite expensive in my area. So, but I am exploring it. I'm kind of put it on pause right now because I want to see how my body evolves.
Got
But I
it.
was
And
thinking to try it for the tinnitus, and the research is mixed on that.
got it. So talking about the expenses, of course, the plasmapheresis is giving hope here. If somebody else is going to try that to go that route, of course, they have to go that route with their doctor. So, two questions for you. Number one, how easy it is for someone to go to their doctor and say, I need this plasmapheresis. And secondly, if they are able to get it as you were, how expensive or not expensive, covered or not covered, what is that journey like?
That's that is an immense struggle because I was lucky my insurance covered it, but we had to piece together some precedent, right? Because you have to remember medicine is evidence-based practice driven, right? So people will tell you, "Oh, well, there's no precedent. Oh, we don't know what your diagnosis is. Oh, so you you have to push the system. I put together the paper. I sent the research papers. I said, here it's been tried. There's been success. So let's, give it a go. And then I reached out to Germany. They were trying it. I got emails back from the scientists there, and I also sent that to my doctors, and I just kept pushing.
Hmm.
It's
And hopefully,
exhausting.
when you
It's exhausting, but you know, you can't give up.
got it, and hopefully, when your own case is published, that hopefully can become a document for others to use that to say, look, here is a
Yes.
patient.
This is my goal, is why when we did this, if I thought there was actual benefit, we would write it up as a case and try to get it published. Because if there isn't something in the research, it's
Got it.
hard.
Got it. Blank blank says, can you post Sean's blood markers because I want to show this video to my doctor? I want a comparison to my blood. I have the same symptoms.
I can post my auto antibody labs.
Okay,
Sure.
so maybe send it to me, and
Mhm.
you can anonymize it as much as you like, and then if you send it to me, I can post it as an image on YouTube, or um, I think I can post that as an image on YouTube and Discord. Okay, so continuing, there is a question here. John Snyder comment, and John Snyder, I believe, is also for a couple of years going through the long COVID. So macrophages misbehaving. There was another question. So apologies, some questions may look a little harsh. Slam RN says, what about his ears? Are they permanently damaged? Could be.
Could be. We don't know. The thing that
Um,
gives me hope is that it wildly fluctuates. And I don't mean that in terms of like when people with tinnitus say they get these spikes. Like my tinnitus is so strange. It's coupled with physical symptoms and it can go very low and quiet to like extreme with sound sensitivity and uh you know physical discomfort. So we don't know.
so
We
when it
we
becomes
people.
quiet,
Mhm.
yeah, that is sort of an indicator that there may not be actual tissue damage yet. Otherwise, it will not go quiet.
Mhm.
Augie says, any lymph node swelling or involvement?
No, I never had any lymph node swelling.
Little Chloe says, they tell you it's stress. Did this happen to you as well? That doctors simply said, hey, this happens and you're just,
I
it's
had
psychological.
I had people tell me to take a vacation. I had people tell me I had anxiety. I had a cardiologist tell me I had anxiety. They were palpitations. And so I started to record my symptoms. So I would sit in the chair. I didn't at that time I didn't I kind of remotely was familiar with positional tachycardia and POTS, but it's not something you see in regular general practice, right? It's like specialists area. But I recorded, I would sit, I'm usually bradycardic, my heart rate is 50s, all the time. And then I would record it with a video on my phone. I'd sit there with my watch showing my heart rate. I would stand up and just for the full 10 minutes show my heart rate going from 50 to 140, 150, 160 and repetitively. And I'm like, well, if that's anxiety, then I must be a magician to be able to magically make it happen just from from sitting to standing.
So Denise says, has all your histamine MCAS symptoms also stopped?
So I tested early on for MCAS labs, and my labs were always negative. Now I know in MCAS world that that's often the case for some people. You have to capture MCAS at certain times, but I wasn't sure if MCAS was the primary driver in my situation, right? And to be honest, we can only hypothesize in my case that it's really antibody mediated because of the response from plasmapheresis. But until we see more people treated and studied, we can't say with definitive what is right. And for the in the injured world, we all sometimes look alike and we have parallels, but I still think that we're not all the same, right? There are people who clearly have myocarditis, there's people who had transverse myelitis, Bell palsy, and then there's these people who have this cluster of bizarre symptoms of neuropathy and autonomic and tinnitus and so.
Got it. Blank Blank says, what is flushing ears? Is it like tinnitus but more of modulating sound? Because I have that too. So
So in
have
my
you?
case, my flushing ear was my ear actually turned red, bright red. I took pictures of that within days of my vaccine. And then I had ear itching and pain, and then boom, I had the tinnitus and sound sensitivity and ear fullness.
And my apologies, I'm not ignoring you. I'm looking at the
Hmm.
comments as well and trying to make sure that I can ask the questions if people have. Um, So there is a question from KC. When tinnitus is louder, is it accompanied by low blood pressure symptoms? My tinnitus gets louder with lowered BP as part of pre-syncope prodrome.
So that's very interesting because in the when I was in the hospital, I never take, who takes their blood pressure during the night? You're supposed to be sleeping, but in the hospital they wake you up at 2 in the morning and you're laying there. They would take my blood pressure and it would be extremely low. I know you have nocturnal dips, but mine would be like 80 over 40, 80 over 50, sometimes 70s. And then I noticed that I'd have like some really loud episodes in the middle of the night. I'd wake up and my ears would be screeching. And so when I got home, I would stay in bed, not move, and I would take my blood pressure. It would be super, super low. And I mentioned that to some of my doctors, and they didn't know what to make of it. But I just noted that I didn't know if it has anything to do, because I know high blood pressure can give people tinnitus, but I didn't know about low. But I do have these like strange, really low BPs in the night, and
Got
my
it.
tinnitus gets loud in the middle of the night and wakes
Got
me
it.
up.
Got it.
But that could just be, who knows.
Yeah. There could be an association, there could maybe not,
Mm,
but you observed the association for your case. So before we ask some more questions, and we should be mindful as well, Shaun is on the East Coast. So here for me on Pacific side, it's only 6:44, but I think it's your 9:44. Um, so a couple of things. One, I wanted to make sure that we are aware that it is possible to have multiple types of antibodies produced when a cell, let's say somebody got vaccine or they got COVID and they got then some memory cells that traveled to bone marrow and stayed there. There they can produce inflammatory molecules, which can then activate the cells in their surroundings. And the surrounding bone marrow cells are, of course, new cells that are being made, stem cells that are there, plus older memory cells that are sitting there as well. So if you trigger them, it is possible that some of them would start making antibodies. We had done this discussion a few days ago that you can activate a B cell without actually giving it help from a helper cell. It really just depends how many IgM on its surface can become connected with an antigen and it would start making more IgMs or more antibodies. So if you activate a bunch of B cells that are memory, they would make their own kind of antibodies. And so you would end up with a plethora of antibodies that are of different types. So that is a possibility of how EBV is reactivated and how these
mhm,
multiple kinds of antibodies can come in. So just wanted to make sure that if somebody who is listening to this to understand that this happens, they don't dismiss that the patient's blood has multiple kind of antibodies and they don't just say that this is just a fake or incorrect
mhm.
test. This is actually possible. There is a question from Dr. Julia. She says, do Dr. Shaun have insomnia? Did you develop insomnia through
I
this?
had about I had about 4 or 5 months of severe insomnia.
And was that
Wild, and
because of tinnitus or
I think it
just
was
general?
the autonomic dysfunction. It was my parasympathetic and sympathetic nervous system dysfunction, because I would I'd fall asleep, and after 15 minutes I'd be bolted awake, and that would go on all night. I'd have like multiple nocturnal awakenings, like but jolts. And a couple of times, like I'd be so tired from not getting sleep, I would nod off during the day in the chair and I would feel the chemicals dump through my body, burn my muscles and stomach, and like wake me up. Like the parasympathetic and sympathetic systems were not working. It was
Hmm.
it was
Got it.
terrifying. In fact, it was, because who experiences something like that? And I think
Yeah.
that's why a lot of people, they also say they have like they've developed high anxiety and panic attacks out of the blue after never having any history.
So thank you. Augie says, any educated guess as to underlying issue or solution? So I guess for
I
the
mean,
solutions, we talked about various things that Shaun did. So pathology, is that a little more clear yet to the doctors and you or not?
I think we're going right now. We're focusing on this autoantibodies and their removal, or people getting them modulated through IVIG. But I think the door is open for multiple etiologies, right? We just don't have enough
Yeah,
data and research yet.
got it. And I had a question, and that was you are active, you have this React 19, you have this group as well, you offer speeches to. Has your journey helped others that you are in contact with? How has your knowledge now helping others? Have you observed that?
I think we do our best, right? We What I can do, I can offer my expertise. So when people are desperate and they don't know how to interpret their labs and their doctor isn't explaining anything, I will offer that. I will help people understand. I'll help people understand how to make the most of their resources, what testing to do, what testing they shouldn't do. Kind of we kind of I kind of try to guide people best I can. I don't have all the answers, but I kind of do my best to guide people how to navigate the health system, right? And right now, you know, joining React and creating this network, we're just filling the vacuum, right? This should really be the role of the government and the institutions, but in their absence and total neglect right now, it's left to us to try to fill that vacuum until there's better days ahead.
Agreed. I actually think that the government systems or leaderships are possibly sometimes actively dismissing these things in the name of this can create hesitancy. But I think they have made it abundantly clear that they realize that vaccines can have side effects. However, what is missing is to create a support system for
Right.
however rare these cases may be, to
That should
say,
have been
let's
part of
help
the
them.
plan from the beginning, to just
Correct.
face it head on, right? Because what medication on this planet does not have a side effect or even an adverse effect? To try to say that anything, any vaccine or any medicine is reaction free is really anti-science, right?
Correct.
So
Yeah.
is
Agreed.
another awakening for me.
Yeah.
This
I
is
had started this message in December 2020 that we should start having solutions, plans for clotting was the very common one that initially started. And I
mhm,
still remember the amount of hate and the attacks I got that I was surprised that here is a medicine, here is a therapy. That therapy would have its pros and cons, and we should prepare ourselves to say, however rare, 100 people out of a billion, still there are 100 people. We're not just going to leave them somewhere and say, thank you very much that you sacrificed for us. We should have a support system for them.
right.
So
We've
that is
become,
missing.
I call ourselves the pandemic pariahs. We really caught in the crosshairs of politics and, uh, you know, and debates. And it's, we are just relegated to being casualties. And it's sad. It's another added tragedy to the already tragic pandemic.
You are very, very correct. So I don't see more questions here. Thank you very much. So once again, if I can recap for the cool beans for the audience here, Shaun had vaccine injury, has vaccine injury, and he himself is from the healthcare profession. I have never seen someone with such persistence to say, I am going to figure out what's going on and I'm going to help myself. And in that process, Shaun has ended up helping a lot of other people as well. And we are fortunate that this is his third time he's discussing his situation with us. And this time he comes with a good and a bad. The good, that the plasmapheresis was done and he is feeling much better for neurological symptoms, and bad is that tinnitus is still there and probably even more bothersome. Am I correct? Or
I think I
similar?
had a big worsening, and now it's just I had the worsening happened before the plasmapheresis, so it's just kind of just bad,
Yeah, got it.
stable bad.
Got it. And so, Shaun, we wish you well. We wish you full recovery. We pray for that. And there are so many people with so many comments and messages to me to convey to
Yeah,
you the good wishes and prayers.
and I'm grateful for everyone who reached out to me from across the world and sent me good wishes and advice. I may not have been able to respond to all of the people, but I had many, many people, and I'm so grateful, and that restores my faith in humanity. That
Absolutely. Same here.
that there are a lot of people who do care and want to help.
Exactly. So thank you very much for being here. Cool Beans, do me a favor. I think that if there is any video that should be shared a little more, that is this one. Uh, so if you can, please share this videos with anyone. So my own family member, I'm going to share this video with my family members who I know will benefit from this message. Plus, there is hope in it. We do not know how many people are actually giving up and they are not telling us for what is happening inside of them. So maybe there is hope. Maybe this can be a little light for someone. So please do me a favor. Please like, subscribe, and share. And don't like or subscribe, just share with some folks who may benefit from this. And Shaun, thank you very much for your time and for these messages that you brought.
And thank you for having me and
You're
helping
very
me
welcome.
spread and raise awareness.
You're very welcome. And Cool Beans, we will not do a chit chat after this. I want to leave these videos up for people to watch them instead of adding one more chit chat to this. We will see each other on Monday. Thank you very much. Have a nice weekend. Shaun, please have a restful evening and a nice weekend.
You too. Take care.